Hello, everyone. Thank you for joining us today. I'm Erica Harquist, Public Health Division Communications Officer with Oregon Health Authority. Today, we are talking about the approval of Oregon's new Medicaid waiver. And this is a friendly reminder to please mute your audio and use the raise your hand function if you'd like to be added to the queue to ask your question. As you saw, Britt is granting permission to record one by one for all of you who would like to record this, which, as you know, can take a bit of time. So we appreciate your patience after you ask us for permission to record. And we always like to reiterate, this is an opportunity for the media to ask questions. We encourage members of the public to ask questions during our Facebook Live events. All right, we're going to get things started this morning. I'd like to introduce OHA Director Patrick Allen to kick things off for us. Pat.
Thanks, Erica. Good morning. I'm Patrick Allen, Director of the Oregon Health Authority. Thanks for joining us to talk about today's truly historic federal healthcare announcement, the approval of Oregon's new Medicaid waiver. I'm joined today by Danielle Sobel, Policy and Government Affairs Senior Director at the Oregon Primary Care Association, Mercedes Elizalde, Public Policy Director at Central City Concern, Sarah Sullivan, Executive Director at Gorge Grown Food Network, representing the Oregon Community Food Systems Network. I want to thank our speakers for coming today to tell you what this groundbreaking agreement means for their programs. I'm also joined by Lori Coiner, who has served as Oregon's Medicaid Director and led Oregon's team in negotiating the agreement with our federal partners. Lori is here today to help me answer any questions you might have about the more technical aspects of this important agreement. Before I begin, I want to thank Governor Brown for her leadership and support during the negotiations with the Biden-Harris administration. She wanted this waiver to be bold in expanding the supports it provides children and families. She wanted it to be transformational in the tools and resources it gives Oregon communities to tackle big problems such as health inequity, hunger, homelessness, and climate change. She wanted it to make a difference in the lives of vulnerable Oregonians and in their broader communities. We couldn't have reached this agreement without her urging and advocacy. I also want to thank Chiquita Brooks LaSure, the administrator of the Centers for Medicare and Medicaid Services. Her team at CMS and within the Biden-Harris administration understood our goals and worked with us to reach an agreement that enables CMS to help Oregon test groundbreaking new strategies to share with other states and give us the flexibility and resources to implement them while staying in line with federal requirements. And most important, I want to thank all of the Oregonians who shared their ideas and aspirations for a better and more equitable health system during the public input process. Finally, I want to thank our staff at OHA who listened to that input and turned the vision we heard from so many community members into policies and proposals that could gain federal approval, get funded, and be put into practice by coordinated care organizations, providers, hospitals, and nonprofits all across the state. So, what's in Oregon's new Medicaid waiver? And why is this agreement so important for the health of Oregon communities and the rest of the nation? Under this agreement, Oregon will be the first state approved to use federal Medicaid dollars to fund medically necessary health-related services, including housing costs, such as rental assistance. As Oregon communities grapple with the challenges of homelessness, Oregon will have new resources to stabilize people who are in transition and whose health is jeopardized because they lack adequate housing. That means fewer people getting sicker because they're forced to live on the streets. Along with Massachusetts, Oregon will pioneer Medicaid funding for medically necessary food and nutritional supports, such as medically tailored meal programs, food boxes, and Medicaid-funded prescriptions for vegetables and fruit. Hunger and food insecurity rose during the pandemic in Oregon, affecting more than 1 in 5 people. Lack of regular, healthy food puts children and families at risk of chronic disease and other problems. This waiver injects additional federal Medicaid funds to prevent hunger and keep people healthy. Oregon is the first state in the nation to provide expanded health coverage for children and extend health coverage for youth and adults. Under this waiver, we will provide continuous Oregon health plan coverage to all eligible children under 6 years of age. That means fewer disruptions in health coverage and health care during a child's formative early years, more children receiving immunizations, and more children receiving treatment for preventable diseases. Oregon's also providing health coverage for youth with special needs up to age 26 to ensure they have access to the supports and services they need to thrive as independent adults. In addition, Oregon will extend Oregon Health Plan coverage for people 6 years of age and up for 2 years rather than the current 1 year to prevent people from churning off benefits, not because they're no longer eligible, but because they don't keep up with administrative requirements. Oregon also received first in the nation federal approval to provide help to people dealing with the impact of extreme heat, wildfires, and other catastrophes caused by climate change. Now, Medicaid can directly cover air conditioners, air filters, or temporary shelter for medically vulnerable people on OHP who are facing harm from climate disruptions. These new strategies will require new resources. Our federal partners will infuse $1.1 billion, let me say that again, $1.1 billion into Oregon to put these strategies in action. At OHA, we've set a goal to eliminate health inequity by 2030. This waiver gives us a package of strategies, tools, and funding mechanisms that no other state currently has to address the root causes of health inequity and make real progress toward eliminating the burden it imposes on Oregon communities. We are very excited to work with all of our partners across the state to put this agreement in action. Now I'd like to turn it over to some of those partners who can tell you what these changes mean for their programs, their patients, clients, and the communities they serve. I'd like to first turn to Danielle Sobel from the Oregon Primary Care Association. Danielle?
Get off mute there. Thank you, Director Allen, and good morning. I'm Danielle Sobel, the Policy and Government Affairs Director here at the Oregon Primary Care Association, where we represent Oregon's 34 federally qualified health centers, also known as community health centers. First, I want to thank Governor Brown, Director Allen, and the Oregon Health Authority for their inclusion of community health centers in this momentous occasion, and for all your work in getting this over the finish line. This waiver announcement is transformational, and we look forward to operationalizing what many are already calling a first in the nation waiver that prioritizes social determinants of health. Oregon's community health centers are already hard at work screening for social needs, and the additional provisions in the waiver will allow health centers to further wrap services around patients, especially those experiencing the greatest needs. The federally qualified health center model is firmly rooted in community, with origins in the civil rights movement that over 50 years ago identified the need to improve the lives of Americans living in deep poverty and in desperate need of health care. Across Oregon, our community health centers, those 34 statewide, provide accessible, integrated medical, dental, and behavioral health services to over 456,000 Oregonians, including 1 in 6 members on the Oregon Health Plan. As the often only primary care home in their community, health centers know firsthand the importance of maintaining health coverage for their patients because of the mitigating impact it has on that patient's access and continuous access to care. When a community healthcare worker is able to enroll a child continuously until their 6th birthday, eliminating the need to re-enroll between visits or verify eligibility or meet with that family again in tough circumstances, it means the child is more likely to meet the recommended screenings, well child checks, during a time in their lives when these are most frequent. It means the child's care team and their family don't have to worry that any seasonal or overtime accruals will cause them to churn in or out of eligibility. And because they are assured of coverage, they won't have to postpone those well child checks, delay needed screenings, forego additional recommended services, or constantly reestablish care with new providers. This means the child is more likely to be ready for kindergarten because they've had up to 6 years of timely screenings that will have addressed any issues that would cause them to be absent or unable to focus because their teeth hurt or they can't see the board. By creating a more stable coverage infrastructure for kids and adults, as included in this waiver, it ensures that ongoing care, treatment, and care management needs of patients can be more easily met and health outcomes improved, especially for our BIPOC patients who continue to experience disproportionate rates of health inequities, exacerbated by gaps in coverage. We recognize the step forward this waiver represents for the state in its efforts to improve equity and eliminate disparity. Oregon's federally qualified health centers have been and continue to be indispensable leaders and innovators in comprehensive and equitable primary care. And we look forward to continue to working with the state and our federal partners to equitably address the health-related social needs of Oregonians and communities across our state, which is made easier with the promise of stable, continuous health coverage.
Thanks, Danielle. Next, I'd like to introduce Mercedes Elizalde, who's the Public Policy Director at Central City Concern. Mercedes.
Hello, everybody. Thank you for having me here today. Again, my name is Mercedes Elizalde. I use she and her pronouns, and I'm the Public Policy Director at Central City Concern. Central City Concern is a nonprofit direct service organization that provides integrated primary and behavioral health care, supportive and affordable housing, and employment services for people who are impacted by homelessness and complex health needs in the Portland metro area. We operate about 2,400 units of housing, serve 14,000 patients annually through our 12 federally qualified health centers, and make 1,200 job placements annually through our Employment Access Center. At Central City Concern, we are very excited about the announcement for the health-related social needs package of services being approved for our state Medicaid program. We see consistent positive outcomes when people have streamlined access to co-enrollment in housing, healthcare, and employment services. Housing is healthcare. When we review our internal data, we see that when someone is provided all three of Central City's core services, employment, housing, and healthcare, they are 5 times more likely to complete their outpatient substance use disorder treatment and be on a stable path to recovery compared to someone who is only receiving that SEDS treatment. And they're 7.4 times more likely to have a successful permanent housing placement compared to people who are only receiving supportive housing. Ultimately, house keys and homelessness, and with access to peer support, physical and behavioral health, and economic stability, people stay housed. People need to find safety first, and then health, and then stability. A good friend of mine once said, Medicaid is not a means to an end, it's a means to a beginning. Our funding and regulatory systems are so fractured, it's possible to live in Central City housing, but not be able to access behavioral health treatment. And it's possible to be in our behavioral health programs and struggle to get housing. This announcement today is the first step towards putting that kind of inhumane inefficiency in our rearview mirror. The new health-related services social needs service packages will be an act of prevention as well as a response for folks who are already struggling. These new services are prioritized by making system improvements. Rather than using diagnosis codes or vulnerability assessments trying to determine who is sick enough to deserve help, this package of services is being focused on transition points, disrupting where our system is pushing people into homelessness, with releases from places like jail, foster care, and the state hospital right onto the streets. Instead, we will now have this opportunity to connect people with housing immediately, create that bridge to long-term stable housing. We are hopeful that CMS will also approve the early enrollment for people who are transitioning out of incarceration so they can be connected to healthcare providers in the community right away. A successful reentry requires proactive connections to community-based services, especially healthcare and housing. We are incredibly grateful for the possibilities that this brings to bridge our housing and healthcare systems for the benefit of the people who need it most. And we really appreciate the leadership of everyone involved in drafting this, getting it approved, and getting to work in the next couple of years. Thank you so much.
Thanks, Mercedes. Finally, I'd like to turn to Sarah Sullivan, who's the Executive Director of Gorge Grown Food Network and is here representing the Oregon Community Food Systems Network. Sarah?
Yes, hello everyone. Sarah Sullivan, and I am the Executive Director of Gorge Grown Food Network. We are based in the Mid-Columbia region near Hood River, Oregon. And our mission is to build a resilient, inclusive food system that improves the health and well-being of our community. 6 years ago, we launched a veggie prescription program to address the fact that 1 in 3 residents in this region are food insecure. In partnerships with hospitals, healthcare clinics, and social service providers, we have supported thousands of families by providing fresh, locally grown fruits and vegetables. We also participate in a statewide veggie prescription working group supported by Oregon Community Food Systems Network, where we collaborate with dozens of organizations to put into practice what we know, that food is medicine. Fruit and vegetable prescription programs are not only effective at improving food security, physical health, mental health, and financial stability, but a recent report from Washington State's Wholesome Wave study demonstrated that such programs are highly scalable. Yet sustaining these programs across the state has been an ongoing challenge. Funding is sporadic, and there are gaps in services that we are able to provide. The number of people we have been able to serve is limited by a lack of funding and complicated mechanisms for enrolling patients into programs. That is why this medical waiver to bolster access to nutritious food and cooking education is so practical and so important. One of our veggie prescription recipients recently said, "For the first time in my life, I am eating healthy." Another person told us her children cry when the refrigerator is often empty. She said now they are eating so many fruits and vegetables. They are more free to just be kids. We envision an Oregon where all people have equitable access to fresh food provided by thriving local farms and local food systems. The overarching goal of our statewide working group is to broadly integrate veggie prescriptions into Oregon's healthcare system, and this is a great first step. While we know the waiver will not enable us to serve everyone in need or completely solve hunger or diet-related disease, it will help healthcare providers who are committed to holistic health and equity to advance food justice. We are grateful to Oregon Health Authority, Governor Brown, and the many people and organizations that enabled this medical waiver to move forward. Thank you.
Great, thanks, Sarah. And with that, I think we're open to answering questions, and I think Erica is going to moderate that for us.
Thank you. And as I noted in the chat for everyone and our media guests, if you'd like to ask a question, please raise your hand and I'll add you to the queue to ask your question. Our first question comes from Claire with the Statesman Journal. Go ahead.
Hi, good morning. Thank you for speaking with us about this. I'm curious about kind of the nitty-gritty of how this gets deployed, particularly the housing funds. Who's going to be responsible for that? Will people kind of, for example, getting released from the state hospital, will they have a caseworker? Kind of how will that all work out?
Yeah, thanks, Claire, for the question. Let me try to tackle that. What the waiver provides, different pieces of the waiver start at different times. So, for example, the continuous enrollment for kids will start when the public health emergency ends because everybody is already covered by continuous enrollment. In the main, most of these benefits won't start until 2024, and that gives us the opportunity to work with CMS over the course of 2023 on what implementation plans look like. And that's a process that would involve coordinated care organizations, community organizations, partners like the ones that are here today, to work through those details of how these different systems will work, how benefits will roll out, how they'll connect to different people. So we'll be able to have those in place and ready to go when they become part of our Medicaid plan at the beginning of 2024.
Thank you.
Thanks for that question. Our next question comes from Amelia Templeton with OPB. Go ahead, Amelia.
Two questions about the sort of cost and financing of this. The first is, you said the feds are committing over $1 billion. That sounds like additional funding, new funding. Medicaid is a state and federal sort of partnership match program. So what is Oregon committing? What does this mean in terms of the legislature and sort of taxpayers' investment in healthcare?
Sure. So there are three buckets to think about in terms of that. There's the directed state health programs piece, which is the money, the $1.1 billion that we just talked about for the health-related social needs element, the housing and food supports and those kinds of things. That's $1.1 billion of new federal money. We're required to contribute $88 million of state money in the very last year of the 5-year waiver period. So $88 million of state money for $1.9 billion or $1.1 billion in federal dollars. Then there's an added cost related to the continuous enrollment. I see you there, Nick. The added enrollment in the Oregon Health Plan for people who are eligible and won't be kicked off. And that's at more like normal standard match rates, where there'll be about $850 million of new federal dollars at the expense over the entire 5 years of $409 million of state money. So you add all that up, and that's about a $500 million state investment over 5 years in return for about a $2 billion, $1.967 billion federal investment of new money. And then the third bucket is there are some implementation costs and other investments necessary that aren't part of the waiver itself, that are part of our budget ask in this legislative session. That's about $145 million.
And then there has been a cost-saving measure that's long been a part of Oregon's Medicaid program, the prioritized list.
Mm-hmm.
And I heard from a policy person I was talking with this morning that this waiver also envisions sunsetting the prioritized list at I believe it was 2027.
Yeah, not exactly. As you observe, we've been using the prioritized list going clear back to the beginning of kind of the waiver era, so something like 30 years. And what we're doing, these are demonstration grants to sort of demonstrate that things will work. We've been demonstrating this for 30 years, and it's more or less been working, though it's evolved a lot over that period of time. And so what we're doing is we're keeping it, but we're moving it basically into the main part of the Oregon Health Plan, the Medicaid program. It'll be part of a state plan amendment, which is a tool we do lots of times a year on how we manage Medicaid in the state. And so the list will continue to exist, but it will not be part of our waiver and not something we have to renegotiate with the federal government every 5 years. That change will occur in 2027.
Got it. Thank you. Last, very briefly,
Yeah.
The enrollment changes go into effect this year, correct?
Well, it depends when the public health emergency ends, and we know it's very likely to continue into January. You hear lots of rumors of lots of different dates that are all over the board. So I think the safest thing to say is these changes will take place when that emergency ends.
Great, thank you, Amelia. Our next question comes from Claire Rush with the Associated Press. Go ahead, Claire.
Hi, and thanks for this. I would just like to confirm that the food assistance and housing services will be just for people who are experiencing those life transitions that you mentioned, people who are at risk of homelessness, and that those services will only last for 6 months.
Laura, you want to tackle that?
Sure, I'm happy to. Yes, the housing services and nutrition services are will be only available for members in transition, though, as you mentioned, the housing or folks who are homeless are included in the transition populations. The only services that are limited to 6 months is the temporary rent assistance that can only last for 6 months, along with assistance on utilities. The other types of supports like housing, tenancy sustaining services, or tenancy post-tenancy services can last for longer than that.
And I just to add quickly, and Lori, correct me if I'm wrong on this, but it's not only people who are homeless, but people who are at risk of homelessness, which broadens that out a good bit. Have I got that right?
Yes, that's right.
And sorry, just one last question. And so the food services are also covered for 6 months, included in that?
Food services also are covered longer. So we have in our implementation plan, we'll have to think about how often consider how often people are screened, but there isn't a limit of time. The only limits are on short-term rental assistance and utility expenses.
Thank you.
Thank you for that inquiry. Our next question comes from Nick. We just wanted to make sure. Did you have a question, Nick?
Yes, thank you so much. I apologize, I'm having technical difficulties. The question is the discussion of the EPSDT program that the state, essentially it seems to enshrine that the state is not going to be applying the prioritized list to children in the program, which is sort of the system in place in 49 other states. And I guess I'm curious, will that remove all barriers for those children in accessing care, or will there still be a special process that OHA will have for them?
Yeah, so early periodic screening, diagnostic, and treatment services, or EPSDT, has been in our waiver forever. again, going back to the 90s, and what it really resulted in was, as you observed, Nick, kids being subject to the prioritized list for those services. Overwhelmingly, those services, by and large, have been provided to kids, and so it's been a fairly narrow slice of that spectrum that have been covered by the prioritized list. We agreed to drop that element from our waiver, and so now those services would generally be covered, but would still be covered by the overall need for medical necessity. And so I think that puts them on more of a par with other kinds of services. And then this pairs up with our expansion of the eligibility of kids with youth with special health care needs, moving that eligibility from age 19 up to age 26. And so we actually broaden the window for those services.
Thank you so much, Director Allen. Quick follow-up. You'd mentioned earlier this morning the 4 aspects of the state's requests that have not been approved at the moment. How confident are you? Which of those are you confident about winning federal approval, and which are you less confident in?
Boy, you're really asking me to tempt fate, aren't you? I think I think we are having productive. This is going to sound like a diplomat's statement. I think we're having productive conversations with CMS on all of those factors, and I anticipate a positive outcome. I think it's hard to say exactly what the details will be on each of those 4 things.
Thank you.
Thank you, Nick, with the Lund report. Okay, this looks like our last question. Unless other media partners would like to ask, you could raise your hand. Otherwise, we will hear from Bryant Clerkley with KGW. Go ahead, Bryant.
Hello, and this is for Director Allen. I'm just curious, so when you say a lot of these things will take place or will start in 2024 after the state of emergency, I think you said, can you clarify, does that mean what state of emergency?
Yeah, so the only thing tied to the public health emergency related to the pandemic is continuous enrollment. The reason for that is currently everybody on the Oregon Health Plan and on Medicaid all across the country are basically already in continuous enrollment. We've suspended annual redeterminations for eligibility. And so once you're on the Oregon Health Plan, you stay on the Oregon Health Plan. That circumstance will end when the public health emergency due to COVID ends. And that's the point that that our waiver for continuous enrollment for kids and 24-month enrollment for everybody age 6 and up will begin. That's the only part that's tied to the public health emergency, because the public health emergency affects enrollment. Everything else has, as I said before, that some starts next year, most of it starts in 2024. The change to the prioritized list doesn't happen until 2027.
Thank you for that question. All right, we're going to give this a little breath, and we're going to give reporters an opportunity to ask questions if you have any. So we're going to wait a beat here. Oh, we do. Claire, thank you so much for raising your hand. A follow-up question from Claire with the Statesman Journal. Go ahead.
Yeah, I'm just curious about how long this negotiation process took.
Oh gosh, it's been going on for months. Lori, you probably know better than I do the exact length of time we've been at this.
Yes, we submitted our waiver in February of 2022, and we've been in active negotiations since then.
And the development and community engagement started about a year before that. So it took us a good chunk of time to get to the point of applying, and then went through this negotiation process. And
Okay.
this is not atypical. These things tend to take a while to work through the system.
Yeah, and then the other aspect I'm really curious about, can you clarify, is Oregon the first state in the nation to get approval to use Medicaid funds for housing assistance?
I do not believe when you construct it that way, that's the case. I think Hawaii has had a waiver like that, but Lori, can you speak to that?
You're right, Director Allen, there's some nuance. That we are the first state in the nation, along with Massachusetts today, who will receive Medicaid matching funds for housing, and where housing and food assistance are treated as a Medicaid benefit.
Okay. I'm sorry, but could you help me understand like how those two things are different?
Sure. So when this is a Medicaid benefit, what that means is, if a person is eligible, then they can receive the service. It's not left up to a health plan to decide whether they can. They're eligible for the service, and then they can appeal. They have appeal rights. So it would be similar to, a person being covered to have a primary care visit, for example.
Got it. Okay, that's really helpful. Thank you. I don't want to take up too much more time, but I am curious about where the housing idea came from. Like, was that proposed by a member of the public or an advocate, or was that something Governor Brown proposed?
That really came from Governor Brown. She was really interested in how we could leverage Medicaid dollars to the best extent possible to deal with housing issues, because housing is really fundamental to so many other issues that we try to address, whether it's mental health or addictions treatment or primary care or basic health. I think it was Danielle who said housing is healthcare. I think you can equally say food is healthcare, and to the greater extent we can move spending upstream. The best healthcare you can get is the healthcare you don't need because you're healthy. And Governor Brown, from the beginning of this process, was really laser focused on that.
Thank you.
Thank you for those questions. All right, we have a follow-up question from Claire Rush with the Associated Press. Go ahead, Claire.
Hi again. Yes, Lori, could you just go over that again? Sorry, I'm not sure I followed on how Oregon's policies here are different from Massachusetts.
I'm not aware at this time how they're different. We haven't seen the Massachusetts waiver approval, but I will say that I did speak to their Medicaid director last night, and many of their housing, the housing and nutrition services are the same or similar. So that approval happened today as well.
Okay, so it would be fair to say that Oregon is among one of the first states in the nation, along with Massachusetts, and not necessarily the very first state in the nation to implement these sorts of changes under its Medicaid program?
Yeah, so if you really want to parse the language, how about tied for first?
Okay, thank you.
I'll also add that the climate change services are unique to Oregon, and we are the only one with that authority at this time.
Great, thank you. Okay, our final question comes from Amelia Templeton with OPB. Go ahead.
Yeah, thank you. Also trying to make sure I understand all of this. The climate change assistance, is that similarly a benefit where if you qualify, and it's not up to the discretion of CCO to pick and choose who gets it?
Yeah, the difference there is it's not a benefit broadly available to all Medicaid members. It's based on medical indication that you're particularly vulnerable to heat events, or you have medical devices that are tied to being powered or sensitive to smoke, those kinds of things. So there is an additional medical necessity, but if you meet that medical threshold, then it becomes a benefit.
And again, just making sure that I understand all of this here. Sorry, my other question just went right out of my head. Give me a minute.
No worries.
I'll just let it go.
Okay. You feel free to follow up once you remember it.
And Claire Rush now has a follow-up. Go ahead, Claire.
Sorry, I don't want to take up too much time. I just following up on Amelia's question there about climate change. Will that also be dependent on where you live exactly in the state, on like which areas are more prone to certain, wildfires or certain things like that, or is it just for all Medicaid beneficiaries who could qualify?
Laura, you want to tackle that?
Yes, so the benefits will be statewide. It won't depend on where you live. However, for the climate emergencies, the services are available during, in preparation or where there's an event. So for example, if there's an area that has been declared an emergency by the governor, then those areas of the state will allow people to qualify.
Great, thank you. And thank you so much for all the thoughtful questions. And just a reminder to our media colleagues that that press release announcing this media availability has all the resources and follow-up information that you might be seeking. It gives a little bit more detailed information, as well as the website, which is incredibly helpful as well. And that is going to wrap up today's media availability. And as always, you can contact us at OHA if you have any follow-up inquiries, and email us at that email address on the release about this media availability if you have any questions. So I want to thank all of our expert guests for their time today.